Namaste to all of you. Dear friends, today's topic is pulse diagnose. Rather, I should say basics to know about the pulse diagnose. It gets a lot of importance in diagnose, but this is not done alone. With the pulse diagnose, we have to know a lot more things. It's combination of all the information what you have gathered with inspection, with conversation, with constitutional analysis. So pulse diagnose, we say in Ayurveda, this is an art. This is an art and you can learn that. So to learn, you have to know a few basics of Ayurveda. You have to know a few basics of Vata, Pitta, Kapha. You have to know basics of pulse also. So we have said that pulse diagnosis plays a very, very important role in prophylaxis and also in the treatment, because we know in Ayurveda for sure that everybody is born with a typical constitution. We call that Prakriti. You are born with a combination of three elements, Vata, Pitta, and Kapha. And in everybody, it's of different proportion. So it's possible that I have got Vata little less, Pitta more, and Kapha moderate. So different combinations are possible in everybody. That makes us unique. That makes us strong. That makes us healthy. That makes us weak or patient also. So Ayurveda believes if you know about your Prakriti, then you can live according to that. You can eat according to that, because it's known in Ayurveda that for which constitution, what type of food is good, what type of lifestyle is good, what he should follow, and what he should take extra, what he should avoid. So a lot of information is given. So knowing your constitution and living accordingly, that gives you health. That way you can build your immunity against the diseases and you can live full span of life, what we call 100 years. So it's your duty to live full span of life. And therefore, knowing your constitution is one of the major tool to get your aim of 100 years. So first of all, we should know the rate of the pulse. Rate of the pulse per minute. You see, heart beats 72 times a minute. That's very normal. Everybody knows. But it's different in everybody. Vata person that can have the rate of 80 to 90 per minute. And Pitta is little less, that is 70 to 80 per minute. And Kapha, because it's an element what is with weight, it's with the earth, it's with the water. That's why that is little less. There's 50 and 60. This rate per minute gives you pretty good idea that what element is prominent in your patient. If pulse is more, then we know that it's towards Vata. Because of prominent Vata, so this Ras, Rakt, Mas, Med, Majja, Assi, Shukra, that is plasma, blood, muscles, fat, bones, bone marrow, that will be little less. And if it's little less in quantity, that we call drying nature, and that is then very light. And the light quality of Vata, that makes this feeble, that makes it move more than other elements. Then if we see Pitta constitution, they will be having a little less than Vata, but Kapha is 50 to 60 per minute because of the Machiri. Machiri is Kapha. Kapha is made of earth and water element. So that's why it's little less. In few videos I have given already demonstration that how one should feel the pulse. If you are going to take your pulse yourself, then you should hold this way so that this wise finger is under your tubercle, under the thumb and tubercle. If you will be putting like this, then this wise finger is on the place of kapha, but we haven't learned that way. It should be always that your index finger is under the thumb, under this tubercle, on the very first position, and should be done early in the morning after having good rest without eating anything. You should feel your pulse and you can count that how much beats you can feel in 15 seconds. If it's in 15 seconds 15 times, then you can multiply with 4, that you know that it's a 60 in a minute, or you can do full minute. So that way you know what is the rhythm. It gives you idea that it's vata, pitta or kapha. So this is general information about the healthy persons. But in lot of diseases, it can be different. Rate of pulse is more in few conditions like fever. In fever, if there is infection, there is always more beats. So pulse rate is more in some chronic diseases like sugar. In sugar, our body has to function extra to get more oxygen, to get more nutrition. So body is more active. That way, our pulse is little more than normal. That we should take also in account. Then second thing what we should see in the pulse, that is a rhythm. Rhythm is the time interval in two pulsation. See, pulse has got pulsation. It comes up, it gives you a spike, it gives you a push to tip of your finger. And that interval in two spikes, that is what we call rhythm. So we see that in normal vata condition, this rhythm, this spike in two pulses is okay. But when vata is increased, it's a hyper, then that is irregular. That is not having the same pause in two spikes. So that is what we can call it's not regular. So if vata is high, then there is irregularity, and if there is irregularity in the rhythm of the pulse, then we should think that vata is more active. So pitta's rhythm is very, very regular. Pitta is regular, pitta is sure, pitta comes up with surety and having same interval in two pauses. So that is what we say regular. And kapha in this case is most regular. So this is the information what helps you in diagnosing the constitution of the patient, that it's vata, pitta or kapha. Then third factor is volume. We must see how much amount of the blood is going through the pulse, how much amount of rasa, plasma, what we say, is giving pressure on the wall of the artery. So amount of the blood that is circulating through the pulse, we call that volume. And that volume you can detect with very simple technique. You just hold the pulse and you just give pressure and leave it. Give pressure again, then leave it. Few times you have to do, and you will see that how much pressure comes under the tips of your finger, and by one person you can see it's very little, by other is too much, and that gives you idea of the volume of the pulse. And with this technique, a lot of doctors, a lot of Ayurvedic doctors, they can tell you how much blood pressure they are having, because that volume is directly related with the systolic blood pressure. Systolic blood pressure normally is 120. If you feel that your patient is having more volume, then you can always tell your patient that your blood pressure is a little bit more. That is, it can be 130, 140, 150, depending how comparative studies you have done on different patients. For example, we know that Vata person is not having that much volume. If in Vata person you find that volume, then you can certainly say that you have got more systolic blood pressure. So very simple technique. Just by holding your pulse and giving it pressure, you see that how high your fingers is being pushed off and how deep it goes. Just by simple technique, by pressing and leaving. Hold it, press it. Hold it, leave it. Then we have got one more factor. We call that tension. So we have to see the tension of the pulse. And this also gives us a lot of information. And how to detect that is very, very simple. What you do, just hold a pulse. So with ring finger, we must block the blood to come into the pulse. So if you block all the blood, even then you are feeling pressure in first, second, third, then is more tension. So if by blocking you don't feel, then tension is okay. But by blocking, if you feel tension, then we say it's a high tension. And if it's a high tension, that we can then certainly tell our patient that your diastolic blood pressure is more. What is diastolic? That is when heart is at rest. Diastolic is mostly 80, 75, 80, 85. So if you still feel the pressure, then you can tell your patient your diastolic pressure is more than it's required. So that way, Ayurvedic doctors, they, without measuring with the meter, blood pressure meter, with the pulse, they can tell you. After tension, what information we can get from the pulse is the movement of the pulse, that how it moves. We call that gati in Sanskrit. And that movement is that how pulse moves. So it can be like snake, it can be like frog, it can be like swan. Here we should think that why Vata pulse has got movement like a snake. Because in Vata pulse, when Vata is prominent in the pulse, then volume is low, then tension is low. If volume and tension both are low, then there is no body for material what is going through. Because volume is also low, tension is also low. Then it has not a sudden movement. So it will be like this. So that's why we call that snake-like movement. And Pitta pulse movement is with surety. It comes up on regular interval. So its movement is like a frog. It has got a definite force in the pulse and it has got a definite interval in the pulse. So rhythm is good, rate is also good. And that makes it more strong. And then comes the third one, that is kapha. We say that it's swimming like a swan in the water. It is very, very regular. You can count on this, that this rhythm, this movement, it has got a definite move. So that way also we get lot of information. And then last one is that what we should see in the pulse, that is the temperature of the pulse. So we say Vata is made of ether and air, and both are cold. If Vata is prominent, then pulse is also cold. So it won't radiate that much temperature to the skin. If it's Pitta pulse, then of course you will be having good temperature. If it's Kapha, Kapha is bit cooler side. So Vata is cold by nature. That's why pulse of Vata person will be cold. It won't give you that much warmth. So we can say that if you are feeling cold pulse, then we can say it's Vata. And if there is warmth that can only be in Pitta constitution, then it's Pitta constitution. And Kapha is in between. It's not that warm, little bit warmer than the Vata because it has got material. It's made of earth, water, and earth or material substance that give always bit warmth. Of course, it's not as warm as Pitta, but it's warmer than Vata. So that way, by knowing volume, rhythm, tension, rate of the pulse, temperature of the pulse, you have already an idea of that in which direction you should detect, you should diagnose further. So then in my other video, part 2, I'll be telling you more about practical pulse examination in part 2. So till then, I hope I could make my point clear here. Thank you very much.